I'd like to start by acknowledging that this seminar is being hosted by the University of New South Wales, which sits on Bidjigal land, which is the traditional owners of the area in which the UNSW campus is located. Here in Australia, we always like to pay respect to elders past, present and emerging, and to our Aboriginal colleagues who are joining us. Of course, in some ways today, we're not meeting on any specific land. We're meeting somewhere, on an ISP, and we're absolutely delighted today that a webinar that we're working on hosting is being co-hosted by 3 institutions. 2 of them are new but close partners of UNSW's Gilbert and Tobin's Centre of Public Law, the Centre for Asian Legal Studies at the National University of Singapore, and their director, Professor Jacqueline Neo, is joining us. We're delighted to be co-hosting with them. We're also co-hosting this webinar with the Centre for Comparative Public Law at the Hong Kong University, which we have a close relationship with both at the faculty and centre level. And we're very delighted that colleagues from that centre, Daisy and Calvin, who will be introduced more fully shortly, are joining us. We also are very lucky to be partnering with Hong Kong and Singapore, but Taiwan as a 3rd East Asian jurisdiction that can teach us important lessons. And in this context, the National Chiao Tung Faculty of Law is joining us, and we're very lucky to have their Dean Wen-Chen Chang representing them. So today we're meeting virtually to think about what the lessons are within Southeast and East Asia for countries like Australia that are about to loosen some of our restrictions and think about how we move out of lockdown into a new phase. The countries in this webinar are all countries that have had a lot of success in limiting the challenges and responding to the challenges of COVID-19. But as they've moved into a new normality, they have seen resurgent waves of infection and challenges. And we're here to talk about what lessons we can learn from each other, how public law plays a role in both constraining and empowering effective responses. And to really think about how we can learn from each other in this new era that we're in. There are very few downsides, very few upsides to COVID-19, but I think one of them is how much amazing international collaboration there's been. You see that with the vaccine and the work that has been done across countries and institutions, but I think conversations like this one are the same. It's about bringing us together in a very efficient, low carbon footprint way to think about the lessons we can learn from each other as we find new paths forward. So without further ado, I'm delighted to introduce my colleagues, Professors Tiernes Roux and Melissa Crouch from the Gilbert and Tobin Centre to chair and moderate this session. They'll formally introduce our panellists, give them a chance to open, and then look forward to taking your questions from the chat and putting them to our wonderful panelists. So thank you very much for joining us, and I hope you enjoy the discussion. Over to you, Melissa.
Great, thanks Ros, and welcome. We're delighted that everyone could join us for an outstanding set of speakers and for this first webinar in what will be a series with the Gilbert and Tobin Centre. So as Ros has mentioned, today we're focusing on Taiwan, Hong Kong and Singapore, and I think we're particularly keen to learn lessons from these jurisdictions. To give a brief context, Taiwan, I think we're looking at 440 cases so far with 7 deaths in a population of 23 million. Hong Kong, I think, has had something like 1,000 cases, 4 deaths and a population of 7 million. And then we have Singapore with 25,000 cases, 21 deaths and a population of just 5 million. Each of these jurisdictions has in the past learnt lessons from previous outbreaks such as SARS. We have Hong Kong and Taiwan with the perhaps additional challenge of managing diplomatic relations with China. And in particular, in recent weeks, we've seen Singapore's migrant worker situation in many ways kind of exposed. There are about 1.5 million migrant workers in Singapore, and with the outbreak of COVID-19 there, it's raised questions about how Singapore about its migrant workers and the working conditions there. More broadly, I think each of these jurisdictions has some really important and pressing public law challenges for us that range from issues of executive and legislative measures, both those that have been successful and perhaps others that we can learn lessons from, as well as the implications for human rights. So let me now turn to briefly introduce each of our speakers, and then what I'm going to do is ask each of them to take just 5 or 10 minutes to give us a bit of a snapshot of and an update of what's happening there. So we first of all have Professor Wen-Chen Chang, who is jointly appointed as Dean and Professor of National Chiao Tung University School of Law and Professor of National Taiwan University College of Law. She serves on the editorial boards of the International Journal of Constitutional Law and Cambridge Journal of Global Constitutionalism, and has expertise in comparative constitutional law, international human rights, and a range of other areas. From Singapore, we have Associate Professor Jacqueline Neo, who is at the National University of Singapore and is the director there of the Centre for Asian Legal Studies. She is a specialist on constitutional law as well as law and religion, and has published in leading journals such as the International Journal of Constitutional Law and Oxford Journal of Law and Religion. She is currently serving as a council member of the International Society for Public Law. And then from Hong Kong, we have Associate Professor Calvin Ho, who is from the Centre for Medical Ethics and Law of the University of Hong Kong. His research is primarily on the governance of health and biomedical technologies, and more generally on medical law and ethics, as well as the normative aspects of health systems. He's currently an ethics board member of Doctors Without Borders, and was previously the head of the World Health Organization Collaborating Centre for Bioethics in Singapore. And then finally, we have Daisy Cheung, who is an assistant professor of law at the same institution, as well as deputy director of their master's program in medical ethics and law there. She has expertise in medical law, mental health law and ethics, and is also interested in assisted reproduction. So we've got a great range of experts. What I'm going to do is now ask each of them just to give 5 or 10 minute update on the situation, and particularly the current debates in terms of how the government is responding and what people there are feeling about whether it's been effective or not. And then I'm going to hand it over to Tina Sru, who will ask our panelists some questions. So perhaps if we can start with Professor Wen-Chen Chang, the floor is yours.
Thank you, Melissa, and thank you, everyone. Thank you for having me. I think this discussion is important, particularly in the region, when the challenges really first came and it hit hard with all of us. And I think in Taiwan, as Melissa just reported, that by yesterday, we only have 440 cases, confirmed cases, and with only 7 deaths. And this being remarkable and miraculous, taken into consideration that, you know, we are so close with China, and we have 23 million people in the island nation. And we also have a lot of close travels with US and Europe. And I think the success in Taiwan has many reasons. But one of the key reasons was the legal preparedness. And really because of SARS outbreak. So we have had a very elaborate legal regime that we call Communicable Disease Control Act, CDC Act. And this act, we have 77 provisions and establishing a chain of command from the central government to the local communities. And the central government is responsible for setting the standards and then defining, you know, which is the disease that require taking prompt actions. And the local government are responsible for enforcement and implementation of all the cases. So I think this has been so far quite well in terms of the central-local relationship. The other side of this act is that we have had already the detailed provisions concerning inspection, quarantine, isolations, with all the standards, and more importantly, I think compensations. And so since last time in SARS, back then our people were not familiar with, you know, isolation, quarantine, and all these sounds very horrible. And then their challenges made it all the way to the Constitutional Court back then. And the court had already issued a decision back then arguing that, well, at the time of this kind of pandemic, these individual freedoms restrictions are inevitable. However, and I think that's one important however, compensations must be given towards those who sacrifices their individual freedoms for the greater public health good. And since then, compensation regimes have been set up. And I think that's also the reason why, being a democratic country of Taiwan, people often are very noisy, and then they will make a lot of challenges. But this time, I think cooperations have been made given the regimes set up previously, and also compensation regimes were already there. And because during February, we had a new Congress just inaugurated. And so because we had early control, so Congress was in session, and they were able to provide funding already back then to meet with all the financial needs this time. So I think these are important regimes that we use, and public law measures we use this time. I would like to also just the last point that for the concern of privacy and for the prevention of discriminations against those suspicious of having virus or even confirmed cases, provisions also in this CDC Act require that all government officials, even private organizations, once they know relevant informations, they have the obligation for confidentiality. And in violation of those confidentialities, administrative fines are imposed up to New Taiwan dollars 90,000 and even $450,000 just to keep the privacy of those with confirmed cases or suspicious of confirmed cases. And also the discriminations are also banned by the relevant provisions as well. So I think although we have some more to discuss about the use of new technologies and then how much they would trump with privacy concerns. But I think because we already have these two provisions there, so there are certain devices there to ease some concerns of the individuals. So I would just provide for now, and then look forward to others' presentations. Thank you.
Thank you so much. And I think you're right that, I mean, Taiwan really does look quite remarkable, given that they have the same, roughly the same size population as Australia, and yet you've managed to keep the number of cases that you have down in a really incredible way, in the way that Australia has not been able to do so. So we've got a lot of lessons to learn from you there. Thanks also for raising the issue around discrimination. Certainly in Australia, we have seen a horrific rise in particularly anti-Asian Australian sentiment. And so that's perhaps something we can come back to in the question time. Let's now go to Associate Professor Jacqueline Neo from Singapore to hear about what's been happening there. Thanks, Jacqueline.
Thank you, Ms. Alyssa. Thank you to the Gilbert and Tobin Center for actually putting this together. So I'm going to sort of share a few things, insights, well, reflections on Singapore. I think Singapore, like Taiwan, was one of the first few countries to have put in measures to counter the growing COVID-19 outbreak. I mean, I think if we recall at that point in time, when Taiwan and Singapore and a few other countries started to put in measures, the WHO had not even decided on what to call this disease. There were various permutations. The North Cove virus was at some point in time the term given to the virus and so on. But, you know, the point is that there was a first mover advantage that was available to many of these countries, and Singapore was one of these. Now, for a while, Singapore managed to keep the numbers very low through a trifold strategy of testing, rapid contact tracing, as well as isolating. The claim was that we would do contact tracing within 2 hours of identifying every single case. The Singapore's approach was initially so good that, and so effective that it was called the gold standard of outbreak management. And indeed, I think for a while, Singapore seemed to have successfully kept ahead of the spread of the disease, flattening the curve, as we now call it. And the best part was that we managed to do this while keeping most businesses open and schools open. which is very important for parents and their sanity. This, however, changed sometime towards the end of March. The number of cases started to rise, initially because of imported cases, as Singapore encouraged its citizens to return from overseas, and tertiary institutions such as NUS recalled their students who were on overseas attachment as well as exchange programs. But at the same time, we also started to see the number of cases rise, indicating that there is community spread despite the strategy of testing, tracing, and isolating. And this could be because of, probably because there was an underestimation of how contagious this disease would be, this disease is, and the fact that there is asymptomatic transmission and so on. And so on 3rd April 2020, this is when Singapore saw a very calibrated approach change, and the Prime Minister went on national television to announce what we now call the circuit breaker. It was initially for a month. It meant that non-essential businesses would be closed. Schools, preschools, and so on would all be closed. It has now been extended for another month. Now, to put things in perspective, when the circuit breaker was announced on 3rd April 2020, Singapore had only slightly more than 1,000 confirmed COVID-19 cases and 5 deaths. 5 weeks later, now, it has more than 26,000 confirmed cases and 21 deaths. So in a population of 5.3 million, this seems like a very high rate. So on one hand, suggesting that the disease is highly contagious. At the same time, we must understand that the majority of these cases, in fact, the vast majority of these cases originated in migrant workers' dormitories. As Melissa mentioned, one argument that has been made is that crowded conditions there could have contributed to more rapid spread. The high number, however, is also because of more aggressive testing of workers living in these dormitories, which means that even if you're asymptomatic, you are being tested. And so this could have caused, this deliberate and aggressive testing could have caused a rise in the number of cases. Of course, this raises a certain significant, I would say, somewhat existential questions for Singapore because of the economic repercussions of what do we do after this. And this is a conversation that has come up. And interestingly, in the Prime Minister's May Day rally speech recently, migrant workers featured front and center in his speech, and the message that was made was that we will take care of you. You have contributed to our economy and we will take care of you. Of course, the issue is always in the details. What would that mean going forward, considering that much of Singapore's economy relies on sort of lower wage labor? Anyway, in terms of how the government has employed legislation, initially, before April, we had relied on the Immigration Act to deal with travel restrictions and the Infectious Diseases Act, which is very much like what Wen-Chen mentioned with regards to Taiwan, where it empowered the government to quarantine persons as well as to declare certain zones isolation areas. With COVID-19, they imposed further regulations where the government could also impose leaves of absence as well as stay-home notices. The idea was to create calibrated approaches, calibrated tools such that they could deal with different types of situations. That April 2020, however, changed that, and so they had to pass new legislation, and is called the COVID-19 Temporary Measures Act. Now, this is important. It's a Temporary Measures Act, which means that it comes with a sunset clause of 1 year. This was followed by regulations, control order regulations, which essentially sort of set out the details of how these control measures work. Now, the control measures, the Temporary Measures Act also provides for a regime of compensation, a regime of assistance to different businesses, as well as to calibrate sort of contractual obligations that could be disrupted because of these measures. So with these measures, there's restriction of movement outside one's ordinary place of residence. You can't gather outside, of course, with certain exemptions such as exercise, which many people seem to be doing more today, which is one, I suppose, positive, could be one positive impact of this. unfortunate situation. The second is the prohibition of gatherings outside one's household, as well as third is the imposition of social distancing requirements. So when you go to shops, there are these lines where you have to follow, and so on and so forth. Now, just to sort of maybe conclude, I think one issue that we will see in Singapore going forward, besides these control measures, is how do we deal with pending elections? Singapore is due to hold its elections, the latest by April 2021. This is because the current parliament will dissolve by January 2021. And so the big issue for Singapore is how do we, if we have to hold elections, how do we deal with social distancing measures? The government has passed a law that allows for persons who are quarantined to be exempted from voting, and that's because we have a compulsory voting regime. In addition, it allows for candidates who may not be able to appear in person because of the control measures to submit their forms by proxy. I suppose one of the big issues in these elections season is that not just for Singapore, but for other countries that have to hold elections, well, firstly is what I mentioned, which is how do we do this safely? But secondly is the concern that elections will now become a referendum on how effective governments have dealt with the COVID-19 situation. And of course, the impact not just on public health, but also on the economy. And so interestingly, and I'll end with this, a survey that was published yesterday here showed that 4 in 10 Singaporeans rate political leaders here highly in their COVID-19 response. This is behind Taiwan, which stands at 52%. And about 34% of the respondents were surprised at how poorly prepared Singapore was. Taiwan fared better at 27%. But interestingly, about 97% of the respondents felt, 93% of the respondents felt that the government had kept the public informed with accurate information. So there was a lot of attempt at ensuring transparency and the communication of information to the people. And so we'll have to see how it pans out, or as we like to say in Singapore, let's see how. Thank you.
Great, thanks, Jacqueline. And I think you're absolutely right. Obviously, the challenges of holding elections in COVID-19 is one that many governments will be faced with either later this year or possibly even into early next year. And it's a big logistical issue, as well as, you say, a political issue, in the sense that in many ways elections may be determined based on the perceptions of government effectiveness in responding to COVID-19. Okay, we'll come to our last set of speakers in Hong Kong. So perhaps Calvin, if you wanted to make a start on the situation there. Thanks.
Thanks very much, Melissa, and hello, everyone. Very glad to be sharing this space with Daisy, as you can see. So we are easing measures somewhat, as you can see. So a note of thanks, first of all, to Melissa, of course, and to G&T Center for hosting this event. Wonderful opportunity to reflect on developments. I'd like to acknowledge our colleague, Professor Po Jen Yap, who has very kindly linked us up with Rosalind, and thank you, Rosalind and Tom, as well as to our colleagues here. You can't see them, Jane and Phoenix have been supporting our work. So note of thanks to everyone. So very quickly about Hong Kong, not very different in terms of the public health measures being put in place. That would be, well, essentially isolation, quarantine, aggressive testing, contact tracing. So these measures have proven to be effective. Hong Kong has, as you know, a long border with the mainland. So, so border control itself has been an important issue. And my colleague Daisy will be speaking a bit more about this, because in the, well, just to complete the point about Hong Kong. So in terms of the control of local transmission of disease, it has been generally very effective. A bit of advert a publication by our colleagues at the medical school, Ben Cowling, they've written up the various measures put in place, did an assessment of the impact, and that has been in the Lancet Public Health recently published, so you can have a look at that. I think they give a very good analysis of these various measures. But from a public law standpoint, Daisy and I felt that a particularly important development that occurred in the early stages of the outbreak was an industrial action or strike that was taken by healthcare workers. And some of you may or may not be familiar with the situation in Hong Kong. So we do have a public healthcare system, a socialized medical system modeled after the NHS in the UK. So which means that critically, the relationship between state or among state healthcare providers or professionals and the public or patients will be central in understanding this particular system. So situating this relationship and of course the impact of this industrial action that occurred, I think is important because for us, our view is that it had a very strong signaling effect when it actually happened. The general feeling, at least on the ground, is that the government may not have been as responsive. In fact, the general opinion was that public authorities were somewhat behind other places like Singapore, for instance, during the initial stages of the outbreak. And essentially what this strike or industrial action served to do was to send a very strong signal to public health authorities that very much more needed to be done very quickly, and also to the public that they ought to be taking on measures, of course, very strongly reminding them of their experience with SARS. So, if you were in Hong Kong towards the end of January and early February, you see everybody already having their mask on, and that's impressive without actually being told that it was necessary to do so. So I thought that this was an important development, and I leave Daisy to speak more about this.
Thanks, Calvin, and I would like to echo Calvin's thanks to everyone involved in this great event. Calvin's done a great job summarizing sort of Hong Kong's approach, but I just wanted to add a few words on the strike, which Calvin mentioned just now. This was a strike, as some of you already know. It was organized in February 2020, very early on in the whole development, and it was organized by a newly formed trade union. It was formed back just a couple of months back. And it was called the Hospital Authority Employees Alliance. So it was basically all sorts of employees, all sorts of healthcare professionals, and also back-end clerical staff from the Hospital Authority. And just to give a bit of background, the Hospital Authority is a statutory body under the Hong Kong government's Food and Health Bureau that, as one of its functions, oversees the public hospitals. So like Calvin says, it's part of this NHS-like socialized healthcare system. And at the time when the strikes were being conceived and being thought about, the government response also, as Calvin has briefly discussed, was perceived as very passive, and given the information that the government and the local experts and we had about the crisis in Wuhan at the time, it was felt that the government was underestimating the urgency of the situation. And it wasn't until there was this huge response from the society, with the healthcare workers' strike sort of being at the apex of this whole response, that the government's response didn't start getting serious until then. So in this way, the strike was organized in response to this perception that the government wasn't doing enough. And the 5 demands that were raised revolved around closing the border. So border control was a big issue, as Calvin mentioned, providing more protective gear and facilities, and then also not initiating disciplinary action against the people who were involved in the strike. And as we might discuss at a later point in this discussion, this strike was controversial at many levels, including whether it was legal. So for example, there are questions about the right to strike, which is constitutionally protected in Hong Kong, and whether it was ethical to do that in the midst of a heavily burdened medical system, healthcare system, was it right for all these healthcare workers to strike at the time? Although it should be mentioned that while I don't believe the measures that were put in place to ensure emergency care were the same as those that were put in place in the UK in their previous strikes. There was some consideration that a limited level of emergency services continue during the strike. So this should be, I think, taken into account as well when we consider the sort of ethical, whether the justifiability of the strike. So that's all I want to say at this stage. Thank you. Thank you very much.
Great, thank you to you both. And certainly Australia shares the challenges of trying to both figure out issues of border control and if and when we relax that in relation to COVID-19, as well as the issues that you've just been talking about, which is really, I guess, the threat that COVID-19 poses to democracy, and the way in which this whole situation may fundamentally shape the way that we know democracy at present. I'm going to hand now over to Tinus Rue, my colleague from UNSW Law, to ask our panelists some further questions.
Thanks, Melissa, and thanks everyone for those really helpful introductions. I have noticed a couple of questions coming through on the chat function, so I just want to assure people who've asked those questions that we are going to get to them. But before doing that, I just wanted to ask one general public law question, if I may, to all of the speakers in the same order in which you presented. And I guess it's the very basic fundamental public law question, which has to do with the separation of powers. So ordinarily, emergencies are associated with changes to the separation of powers, both vertically and horizontally. So centralization of authority and lawmaking power in the executive and in the central authorities. And both of those shifts are often associated with democratic accountability problems of various kinds. So I wondered whether each of the speakers could very briefly just reflect on the extent to which there has been this kind of shift, either vertically or horizontally, in the separation of powers. If so, what has been done to mitigate some of the typical problems that are thought to arise when that shift occurs, and what we can learn as a public law community from this experience. So Wen-Chen, Chang, if you would like to start and comment on that, thank you.
Yes, this is certainly a very important question. As I said, so Taiwan CDC control delegates quite expansive powers to the Central Command, headed by our Minister of Health, along with a group of health experts. Although I said that in the CDC Act, many measures have been placed in the law and clearly stipulated the legal basis and also the validity and also effectiveness. But still, I think the Central Command, Minister of Health, the reason that our minister now wins the support, very high approval rating, also comes with this expansive power delegation. And I think there are two ways that have been done to mitigate this expansive power delegation from the CDC Act. So the first one is, as I said, so our new Congress was in session during April. And so on April 25th, that special act against COVID-19 was passed. And then to further give the powers to the Central Command. But two provisions then in the new law were critical. So one provision asked the government will have to report to the Congress in 3 months after this new special act for reporting on the success situation of the combating COVID-19, as well as their compensation regime. Further on, they also require in 6 months, again, the government will have to report to Congress about the situation. The other thing, very similar to what Jacqueline has reported, in this new special act, that mainly providing for further power and compensation regime, it also has a sunset clause. So the law would be put into an end. In other words, the more expensive power given to the Ministry of Health will be ended in 2021. So I think there are certain measures to mitigate the kind of executive power expansion during the time of public health emergency. The other thing I want to stress is I think the expansion of power in the executive can be divided into 2 kinds. One is the kind of power expansion for politicians, those in high political offices. The other, however, I think is also important, sometimes under-evaluated, is the power expansion to experts. So I think in Taiwan, what's being given the power expansion is the group of experts. You know, the health ministry, along with many other scientists, they are now given a lot of powers in this fight. But in Taiwan, I think luckily, or I should say institutionally, the powers have not been given too much to the political offices. So I think that's also important that those experts, you know, when they are given power, they will have to prove their efficiency by their expertise, not by power manipulation. And so in Taiwan, since end of January, we have been seeing a phenomena unseen in the past, that we have our health minister, along with many top scientists, and have daily briefing to the public, explaining in layman's language those measures and what's been going on. And I think that's also important to create a forum, a space for public dialogue of those scientific nature and those technical nature of the measures to the extent possible, so that the general public will understand why these measures are necessary in their language, but by and through the experts, rather than those sitting in the high political offices. I would just conclude right here, and then maybe some more can be said later on. Thank you.
Thank you, Professor Chang, for that very rich set of reflections, especially the last point about expertise, which was a new idea for me. So I suppose a lot of us might have initially been quite pleased about the transference of power towards scientists, given the worry about populism that has been coursing the globe in the last 5 years. But you interestingly say that in turn raises accountability issues of its own. And you were describing the ways in which plain language explanation and debate of scientifically grounded rules is also necessary. So thank you for that reflection. Jacqueline, Neo, I wonder whether you could reflect in the same way on Singapore. Thanks.
Right, thank you. Thank you for that question. Well, I think it's important to perhaps point to certain unique aspects of Singapore. Singapore, of course, is a nation, it's a sort of island city-state. It has, with a small population, and sort of a government that has been dominated by one party since 1965. And so one way is to examine what happened in Singapore from separation of powers perspective is it worked exactly the way it was supposed to work based on the design, the institutional design, as well as the political condition, which is that with a ruling party that has more than 2/3 of overwhelming number of seats in parliament. This meant that it could be very responsive in passing new legislation. And I think this is a record. We managed to pass the COVID-19 Temporary Measures Act within a day. 3 readings within the same day. So it was really prompt in the government's response when it needed to put in these control measures. So I suppose one fascinating thing is that it is, well, 2 fascinating sort of observations is that in general, the opposition has been supportive of these measures. Of course, there were things that they were critical about, but in general, there was no sort of strong opposition against many of these measures, which were deemed to be necessary to counter the public health situation. Now, the second thing is the fact that the government has sort of strongly emphasized the need for any legal basis for restrictive measures that are in place. Now, this is, of course, sort of also supplemented by the need, it seems, for the government to show that it's being transparent as well as being accountable. So going back to the point that Wen-Chen was made about sort of the delegation of powers as well as the use of experts, it's interesting to see that the Ministry of Health is at the forefront. I mean, it's interesting, but from a sort of separation of powers perspective, that the Ministry of Health, the Minister of Health is at the forefront of this response to COVID-19. At the same time, if you look at there is an inter-ministry task force, and it's led by 2 ministers. One, the Minister of Health, obviously. The second is the Minister of National Development, which means that they see this issue as an issue that is not just an issue that impacts public health, but that could really have an impact on national development, on the economy, and so on. Their daily briefings involves these 2 ministers, as well as the Director of Medical Services, which goes to Wen-Chen's point about how it's seen as necessary to inject expertise into the response. In addition, the control measures, the regulations, which are delegated subsidiary legislation that are being ministers put in place because of delegated authority through the primary statute, right? So there's a primary statute, which is a Control Measures Act, delegates power to minister to promulgate subsidiary legislation. The subsidiary legislation on control measures was promulgated by the Minister of Health. It was not considered to be a sort of home affairs issue or anything else, but it was promulgated by the Ministry of Health. And so we see here that I think it's important to see when we look at executive power, not just the delegation of power, but the delegation of power to whom. Yeah, so those are sort of my observations with regards to separation of powers. There's also certain unique aspects of Singapore, which is the fact that we have an elected president who has to sign off on any budget or any proposed spending that draws on past reserves of the government. And here we have the elected president supporting these drawdowns on past reserves in order to support the economy through various types of economic measures, as well as payments, support payments to citizens. So those are my observations in response.
Thanks very much, Jacqueline. And perhaps we can go finally to Hong Kong on this question before we move to pick up some of the questions that are in the chat. Thanks.
Okay, thank you very much for the question. So let me just start by sharing my thoughts and then invite Daisy to add her points. In Hong Kong, at least by early February, quite a few measures, public health measures have been introduced, and these are all backed by regulation. So I think the due process requirements would have been satisfied. Like Taiwan and Singapore, there has been a very strong collaboration between the government on the one hand and medical as well as scientific experts. So we see a lot of inputs from our colleagues, particularly at the medical school and School of Public Health. So, and this is not just expertise within the territory, but also from elsewhere through, say, WHO networks, for example. So, so we have those sort of contributions, again, quite similar to our colleagues elsewhere. Of course, I think in Hong Kong, it's in terms of the public law issues that's specific to the outbreak, they're relatively, in my view, small compared to some of the even larger issues, as all of you may be familiar with, particularly in terms of the relationship with the mainland. So, but I think it's important to highlight that we should not be too quick to conflate the two sets of issues because they're quite separate. And I think as far as the management of the outbreak is concerned, it seems to me that it hasn't created too much of concern in terms of the constitutionality or legality of the actions. And I think the government has also been very transparent and open in terms of providing figures and updating the public in terms of various developments. And there has also been relatively good coordination among the various government agencies. Daisy, what do you think?
I agree entirely with Calvin. The only thing I want to add is that we have quite a different system from the other two jurisdictions here. We don't have a democratic system, and we're a very executive-led system in Hong Kong. So the government is given very broad powers to enact regulations in these sorts of situations, which the public, especially in public health responses, is very much, is generally very accepting of. So I would say that these issues didn't really arise so much in the Hong Kong context.
Okay, thanks everyone for your reflections. It's probably premature to say, but the sight of government ministers holding daily press briefings with informed journalists asking probing questions, I suppose, is a reason for some cautious optimism that COVID-19 might actually drive a kind of a direct democracy. That we're learning about how we can live more immediately in the present in the way we relate to those who wield power over us. But I guess it's way too early to be that optimistic about the consequences of this pandemic. Perhaps now, if we can move to some of the questions that have been asked in the chat. To save time, I'm going to sort of summarize a few of them, but I would also ask the presenters if you could look in the chat function if you have access to that, and also read through the questions and respond to the ones that you think are most pertinent to you. I think that'll save time as opposed to my reading them all out. But the first question was to you, Professor Chang, and it was from Ros Dixon, and it was followed up by a couple of other people as well. It was a question first to elaborate a little bit on the compensation measures that you spoke about, and then a question about the extent of public trust in the privacy assurances and guarantees that have been given. So if you could very quickly comment on that, and then we'll come to the question about the right to protest. Thanks.
Yes, thank you. So the compensation regime has been quite elaborate, as I said, since the last ruling from our Constitutional Court. So in the CDC Act, as well as in the Special COVID-19 Act, both provisions provided and demanded our government will have to pay compensations to those required for isolation, quarantine, and special inspection. And so for now, for those, there is a provision to exclude those who are rich in the sense they are able to still receive their employment pays and so on and so forth. So they have certain level of income. But in general, for those who are met with the criteria, they will be able to receive 1,400 daily for 2 weeks, the period of their quarantine or isolation or needed inspection. And more importantly, I think we also pay compensation to those health workers. And so, and then and for those health workers, not only they are rewarded, but they are over time working are also compensated. And I think that's a very reason that we have not seen the kind of health worker strike, or we have been had, fortunately, the cooperation from our health workers. And the other thing about the trust of privacy, I have to say, even though we have the 3 provisions in the CDC Act, privacy and also anti-discriminations and also protection of legal rights of those with confirmed cases or suspicious of confirmed cases. Still in the very beginning, so when the government, in order to do the very effective contact tracing, they integrated 2 data, 2 big data really in Taiwan. The health record data, as you know, we have also the universal health coverage. So, so the health data, as well as the travel, immigration data. So that really promoted a lot of concerns, even though, as I said, in the law, those who have access to those 2 data and also the integration of the data will have to be obligated for confidentiality. And then any manipulation or misuse of the data information will have to be fined. But still, people were not entirely trust with our government and then worried, rightly so, I think, with the integration of the 2 biggest data we have in Taiwan. And so in the Special Act, there was a sunset clause for that integration of the 2 data sets, and also demanding of the government will have to erase all these data after the pandemic becomes over. So I think the legal measures there, and also the kind of vital discussion. So even during the pandemic, our human rights communities, our legal communities have not been silent. They have been very outspoken about potential human rights violations of all these measures. So I would say the dialogues have been ongoing for good. And so even though people have a huge trust to the health experts and then the government with a lot of delegated power from the law, but I think it's necessary for democratic, transparent society to have ongoing discussions, permitting human rights concerns to be voiced. And I think that's in part the key to Taiwan's success in this time of pandemic. Thank you.
Okay, thanks very much. So the second question is about the right to protest. And I think the question is really about to what extent this has been respected during the pandemic. And particularly given that the act of protest itself poses a problem from the point of view of the spread of the virus. And I want to deviate from the normal order and perhaps go to Hong Kong on this question, because there was a follow-up question asking for our Hong Kong guests to reflect particularly on the impact of the pandemic on the ongoing democracy protests in Hong Kong. So perhaps if we can go to Hong Kong for this question first, please. Thanks.
Yeah, thank you very much for the question. So Daisy and myself have argued quite strongly in favor of maintaining the right to protest, particularly for healthcare workers, and in the context of an outbreak. If, as I've mentioned earlier, because of this tripartite relationship of state professions and the public, if one party, and in this instance, the professions themselves, see an imminent threat to the public health system, then there is an ethical duty, I would argue, for the professionals to raise this particular alarm to the other key partners in this relationship, i.e. the state and the public. And I think that this has had an immense impact on how we have done in this particular outbreak. I think it's helpful to mention, I haven't done that earlier, I think, is that Hong Kong did not need to go into a complete lockdown. And I think this could in part be credited to the actions that were being taken by the professions in highlighting the great need to put in place public health measures very quickly and in a very aggressive manner. So I do think that this is also consistent with ethical arguments in respect for professional autonomy. So this concept is drawn from medical ethics, and a bit of advert as well. We're writing up a chapter for our colleague Victor Ramraj. Some of you may know him at Victoria University, so if you should be interested, we'll be happy to share this when it's available. Comments are most certainly welcome. Daisy, over to you.
Calvin very brilliantly summarized our argument on the right to protest for healthcare workers. So I'll just briefly address the other sort of remaining question about protests more generally. I think it is very likely that sort of pro-democratic protests will continue, but the question is whether these will be sort of the ones that are formally that have been given a notice to proceed will be given this notice in light of the situation with COVID. And in fact, on May 1st, the protests were banned. The usual protests that are scheduled for May 1st were banned in the name of COVID. And so it's likely that, you know, in the near future that any sort of large-scale protests will be banned by the government in the name of COVID. Although, as you have seen from the news, there have been sort of smaller scale protests that have been already occurring on quite a regular basis over the past couple of weeks or so. So, I mean, in light of the right to protest, it would be interesting to see sort of whether this challenge is raised. You know, if the right to protest continues to be continue to be not allowed to exercise their right to protest in a longer term due to COVID. But as of now, it doesn't seem to have been an issue that has been raised. Thank you.
Okay, thank you. We're predictably starting to run out of time, so we really have time only for one more question. And this is a question around the freedom of movement. So I'm trying to combine two questions here. There was a question about the extent to which groups, individuals have been able to challenge stay-at-home orders, and then a related question about the extent to which freedom of movement has been restricted, mainly through legislative or executive determinations. And perhaps Professor Neo, since you haven't had a chance to reply to a question yet, you'd like to address that, or indeed any concluding reflections that you might have. Thank you.
Thank you. So in general, there's always judicial review of any exercise of executive power. This would include any of these stay-home orders and so on. But of course, the fact that there could be judicial review doesn't mean that it would be effective. Firstly, of course, many of these stay-home orders or stay-home notices, leaves of absence, or quarantine orders tend to be 14 days. So by the time a matter gets through the courts, that's too late. You would have served the order anyway. Now, what we do see is those who have defied some of these orders have actually been prosecuted in court. What might be somewhat, I suppose, of concern is also the amount of attention, public attention, and perhaps some amount of doxing that's going on with regards to people who have been seen to be violating these orders, which suggests that these legal provisions are now also seen as community norms that have resulted in a certain degree of online vigilance actions. So I think beyond, freedom of movement, there are these issues, but the sort of side issues that we also have to pay attention to is the right to privacy of some of these, of those who have been subject to stay-home notices, as well as the other privacy concerns with regards to people who are being harassed and because of certain orders made against them and so on. So, thank you.
Thanks very much. So we are now out of time. I think I'd just like to hand over to Rosalind Dixon then. Ros, if you're still there, for guidance, whether we should stop now, and if so, whether you'd like to conclude the meeting.
I think Melissa just wanted to say something quickly, and then I'll do that. Thank you so much.
Yes, just very briefly. I mean, simply to say in some concluding remarks that I think from our speakers today, we've really heard of the shared challenges that we all face, and I guess the ways that we can better confront these challenges when we have the opportunities to learn from each other. I think Australia certainly has much to learn from the region, both from Singapore's quick early response, from Taiwan's low death rate, from Taiwan's low contraction rate, and from Hong Kong's low death rate, all of which are very admirable. For me, I think one of the major themes that has come out of this is perhaps what I would call the responsiveness of democracy, or perhaps the extent to which we are seeing governments around the world responding to and protecting the political, social, or economic rights of those who are most vulnerable at this time, whether that's healthcare workers or whether that's migrant workers. And finally, we've covered a lot of ground today around, I guess, some more technical matters, both on the medical side as well as on the legal side. But it struck me very much that a lot of this comes down to communication, or the way in which our politicians, as well as our experts, are communicating to the public about the kinds of policies and plans that they're putting into place, and the way that the public is responding to that. So very much a challenge around effective communication. I'd just like to thank all of our speakers, but I'll hand it over, Ros, to do the official final thanks.
Thanks, Melissa. Thank you, Tines. People now need to go, and the one thing about webinars is you can't run over, but I just wanted to say thank you to all of our speakers for a terrifically informative and interesting discussion, and to the centres that have collaborated with us. As Melissa said, we've learned a lot, and we look forward to keeping the conversation going. Gilbert and Tobin will be having a series that looks at the role of cruise ships, proportionality, federalism, technologies and apps and tracing. And we would just love our colleagues in Taiwan and Singapore, Hong Kong and elsewhere to keep joining us. And if you're listening from elsewhere, the same message. So we're reconvening in 2 weeks to talk about cruise ships, an issue where, as Melissa said, trust and communication could not be more central. And we very much hope that we will continue to have a conversation that's both with many of our friends and colleagues here at UNSW and Australia, but also in the region. So thank you all. Stay safe, and we look forward to joining for another conversation again soon.